Welcome back to Midday Kentucky, everyone. Well, Dr. Henry Wells from Wells Plastic Surgery is in-house, and we're talking all about breast lifts, breast procedures, breast implants, because guess what, everyone? It's summer. Now is the time to get those procedures done, because there's not a lot of downtime and you can be out on the beach, on the lake, looking amazing. Welcome to the show, my friend.
It's great to be here, Troy.
Okay, you now have an in-house surgical suite. How does that help the patients? Explain what that means.
Well, first of all, it's very discreet, and they can do it in very privately.
Yes.
And also, it'll save them money because we can pass our savings on to the patients, and we can control the cost better.
Well, we love that.
Yes, we do.
Okay, I'm going to go off question here just a little bit. There are different types of breast implants, aren't there?
Yes, there are.
Can you explain those different ones for me?
Well, there are different profiles of implants. For example, there is a low-profile implant for patients who have a wide chest and don't want to be very big. Or if you're someone who has a small chest but you want to have extremely large breasts, then you can go with a higher profile so you can get the projection without having the width of the implant interfere with activity.
Okay, and silicone versus, what's the other one?
Saline.
Saline. What's more modern? What's better for you? How are we working with these nowadays?
Well, both implants I think are very safe. Saline, of course, has been used for years and years and years, and the silicone gel implants just were put back on the market about 10 years ago. But they've proven to be very safe and very, very popular because they don't get the rippling and the wrinkles that the saline implants do, and they feel more like natural breast tissue.
Well, that's what we'd like to hear. Now, let's bring up that image again that we just had up before. This is actually one of your patients.
Yes.
Talk to me. She looks gorgeous.
Well, she is.
Absolutely.
Is
that a staged photo shoot you've got there?
She is a Hawaiian tropic model, actually.
Wow.
And she was done a few years ago, but she's a beautiful girl, yes.
Now, what age would someone be looking at to have an implant? What's your guide on that?
Well, any age, really.
Yeah.
I have done breast augmentations on 18-year-olds, and I've done breast augmentations on women in their 60s.
Okay.
So it is a question of the patient feeling that they would look better and feel better about themselves if they had larger, more attractive breasts.
I got
When
you.
they're young, they may not have developed breasts that are large enough. When they're older, they may have had children and lost volume in their breasts.
Well, we're going to get to that in just a moment also. But let's talk about, we're going to jump back into your in-house surgical suite.
Yeah.
And I want to understand, is the procedure different? Talk the patient through what happens when they come into your in-surgical suite.
Well, just like any surgical center, we have a pre-op area, recovery area, and an operating room. So they come in and they get ready for surgery and go to our pre-op area. They get an IV started, and we give them some medication to relax them. Then they go into the surgical suite. Breast augmentation takes about 2 hours. They are given more IV sedation. We use a local anesthetic as well. And they really don't remember much of anything that happened when they have the surgery. And they come back out, and not having been put to sleep, their recovery is much quicker. There's less nausea, and they can get back on their feet
And
much
easier
quicker.
on the body.
It is.
Like you're snapping back to work really quickly.
Really.
Talk to me a little bit about downtime for a breast implant.
Well, in the immediate post-operative period, you're going to need to have some narcotic pain medication, and that's going to limit your activities. For about 4 or 5 days, you may need that. But after that, patients can become more active.
Yes.
They can go back to work a week after the surgery.
1 week?
Yes, as long as they're not lifting over 25 pounds and doing any kind of vigorous physical activity.
Okay, I got you. Now, look, we talk about breast augmentation for women who are fit, maybe healthy, and just want a larger size. Now, it's not one size fits all. There are women that it doesn't work for. Talk us through that. So an augmentation isn't just about implants, is it?
No, a lot of my patients, in fact, I would say probably half of my patients have had children, and they have nursed children. They've lost volume in their breasts, and so not only do they need an implant, but they also need a lift, and we can do that as well.
So talk me through the lift. What is that going to do with an implant?
Well, when you have children, the breast envelope expands.
Yes.
And the lift allows us to reduce the skin envelope and lifts the implant once we put it in.
Sounds perfect. And we're looking at a picture now. And what do we do here?
This is a patient who's had children.
Yes.
She has loss of volume in her breasts, and you can see in the picture on the left there, the before picture, she
Gotcha.
does have some sagging, although the bra holds that up.
Yeah.
But she had a lift and a breast augmentation, and now her breasts are much more youthful in appearance.
I was about to just say to you right then, it's a much more youthful look as well, isn't it?
Yes, it is.
Okay, Dr. Wells, as always, you always give us great information. And as I said, summer is here. Having an in-house surgical suite is going to save the patient money. We appreciate you. We're going to put up all the information of Wells Plastic Surgery and Skincare. There's the phone number. Give them a buzz, everyone. And you know what? Drive on over. Marsha and Sheila will give you a wonderful conversation, and you can have an in-house consultation. Just give them a buzz. Pop on over as well. It's a beautiful suite over there. We appreciate you coming in. We'll be right back after this short break, everyone.